Philippine General Hospital or PGH is still unable to accept new COVID-19 patients due to its facilities being overwhelmed. Let's find out what's happening from on the ground. Joining us via Zoom is PGH spokesperson, Dr. Jonas Del Rosario. Dr. Del Rosario, good evening. Thank you for joining us. Doc, how is the overall COVID-19 situation in the PGH? Is this really the worst you have seen since the onset of the pandemic?
It is. Thank you for having me. This is the highest number that we have. Currently, we have about 300 COVID confirmed patients admitted to PGH. So for the past 16 months, this is the highest number, much higher than the previous two surges that we had. And it occupies almost full capacity of our hospital. We initially started with 250, increased the bed capacity to 300, and so now we're 300 beds occupied, and we have to increase a little bit more. So the one limitation that we have is the manpower. Even if we open more beds or try to open more wards, we're limited by the number of healthcare workers who can take care of these patients.
Right. I guess it would be moot to ask how health workers in PGH are holding up amid this surge in cases. But you're not the only hospital to tell us that. We spoke to the Private Hospitals Association, and they're also experiencing the same problems and telling us the same things. Doc, if I may ask, why haven't we built enough capacity in the past year and a half?
We have, the thing with the PGH, we have a finite number of employees, healthcare workers, trainees, doctors. We try to fill up as many as we can for those unfilled positions. And even then, the demand is quite high. One thing about PGH, we also take care of non-COVID patients. And so this finite number, you have to allocate them both to COVID and non-COVID. And since the COVID patients are increasing, we actually have decided to basically shut down our elective non-COVID admissions so that we can redirect and assign more of our healthcare workers to the COVID. And even with that reallocation, the demand is quite high because there are really more patients coming in. And so we're forced to further cut back on the non-COVID operations to beef up our COVID operations. The other thing that also has to be factored in is sometimes our healthcare workers get sick, so they can either, because of the physical demands of the job, so they can get sick. Some of them will actually have COVID, and some of them will get exposed, so they also have to be on quarantine. So that also further decrease the number of available frontliners to take care of these patients.
Right, understood, Doc. Thank you for painting us a clear picture of what's going on there in hospitals right now. Now, you're talking about a lot of people getting admitted and you're seeing these highest numbers, but I want to find out, Doc, how many of these, or the quality of these infections. Do you see vaccination working in simple terms based on the numbers that you see and the recoveries maybe and the quality of infection?
Right. Okay. So we look at our numbers so far. About a week ago, we look at how many are vaccinated and how many are unvaccinated admitted to PGH. So roughly about 70% of the hospitalized patients in PGH are unvaccinated. So it's probably a reflection of the number of people who are unvaccinated in the communities. But what is more important in our data, we also saw that 70% of those who are those who are severe or critically ill, they are in the ICUs. 70% of those are unvaccinated. And about 75% of those who are intubated, meaning on mechanical ventilation, are unvaccinated. So clearly we see the sicker patients, they're unvaccinated, and most of our vaccinated patients, they are moderate to severe, and most of them will recover.
All right, that's very good to hear. Now, I want to switch just over to another topic, Doc. Based on your observations and the patients you come across, are more children and families more children really getting infected with COVID-19 through their families, I suppose, is what I'm asking.
Yeah, we are getting more, requests for admissions to PGH. According to our pediatric infectious disease specialist, they are getting more inquiries for transfers. Clearly, it's a reflection of the increase in community transmission. And just like what you said, it's usually a family affair. If the parents get infected, chances are sometimes their kids will also get infected. So it's just a reflection of what's going on with the surge. But yeah, there's a slight increase in the trend of the number of pediatric admissions in PGH. That's why we're planning to increase the number of COVID beds dedicated for kids.
Right. I guess one last question, Doc, about the Delta variant. Do you guys have a head count, or do you keep a head count of those infected with the transmissible variant there in PGH?
There was a time when we actually routinely submit our specimens to the Philippine Genome Center so that we know who among our patients actually carry the Delta. But there's so much demand from the Philippine Genome Center, so eventually we presume that almost everybody has the Delta variant. There was a time when about 21 out of the 72 samples from the Philippine Genome Center came from PGH, and it was positive for Delta. The increase in the transmissibility, and we're also seeing that a lot of younger patients are coming in. It's probably really due to the Delta variant.
All right. Thank you so much for your time and sharing all that information with us. PGH spokesperson, Dr. Jonas Del Rosario via Zoom. Thanks, Doc.
Thank you.